You can keep the psychiatrists busy, and they're happy with that. And we need them, and I'll talk about positive aspects of that later on, but it's so important in my mind. And the reason is that simply helpful physical treatments may never be considered or instituted if that is the case. Stressors, such as contaminated environments, may never be corrected. And those who suffer would, by getting rid of the rapid psychological theory, reflex there, then the patient is not wrongfully embarrassed, shamed, written off, ridiculed, or rejected. The psychogenic theory is actually hard to prove. And as you look at environmental factors, there's a lot that disproves it. Patients I see that have reactions to molds, I feel worse in this building, I feel better over here. I'll give you some case studies here in a few minutes here. And then we do blinded trials. We test for molds, we test for chemicals, little skin tests or under the tongue tests like that. Oftentimes in a blinded fashion where the patient doesn't know what you're testing for, and they can tell you if they're reacting. You can watch. And then there are genetic studies also. And genetics are not psychogenic. So persons with genetically identifiable inability to clear toxic waste are at higher risk. And the example is that a particular form of the PON1 gene occurred in substantially higher frequencies among those who suffered Gulf War syndrome than those who were unaffected. By the way, let me give you some examples of the way environmental exposures worsen disease to help you understand why in our practice we include environmental cleanup as part of routine management. Michael Gray is an acquaintance of mine from Arizona, and he did a study looking at fibromyalgia incidence with exposures to toxigenic mold, those that were exposed to chemicals, and those who were not exposed. So fibromyalgia, what's the impact of being around molds? What's the impact of being around chemicals? So on. And so he noticed that in 21% of mold-exposed patients, fibromyalgia developed. In 11% of chemically exposed, fibromyalgia developed. And that was in contrast to only 4% in a general internal medicine population. One of my cases here is a 41-year-old female who had some muscle aches and some fatigue for several years before she moved into a new home, which, by the way, she built to be environmentally safe. I've heard this story too many times. And within 2 months of moving into the home, she had increasing muscle aches, fatigue, nausea, recurrent sinus congestion, swollen glands, and malaise to the point she could not carry out her work. Since medications had not helped her in the past, she tried Chinese medicine and electroacupuncture-based therapies before seeing us. What she mentioned in the story was that 3 times she'd been away from her home to the ocean, the mountains, or the beach, or the desert, and on each occasion she felt much better, and upon returning home had recurrence of the sore throat, nasal congestion, muscle aches, and fatigue. She was a chronic fatigue fibrotype patient. Well, she did some studies there, and it turns out that this new home had a water problem in the lower level, and it was the water was sneaking underneath the hardwood floor that she had down there. And mold was growing, Aspergillus, Penicillium, Cladosporium, and Stachybotrys. Several of these, if you have looked at molds very much, you'll know make mycotoxins, which are poisons, in addition to the usual spores, the spores causing the allergies. She was skin test positive for each of the 4 molds, and we were able to do a marker for mycotoxins, and she was positive to that also. She also had an internal fungus load, by the way. We did a stool sample and found a lot of candida growing there. If you have problems with mold externally, we oftentimes look internally, and the patient that is growing fungus will also have problems beyond what you'd expect from the outside exposure. Remediation of the home and treatment of the fungal infection improved her situation greatly. So it was no pill, wasn't even one of my allergy shots. It was just cleaning up the space. Made a big difference there. Here's another one. This is a 30-year-old female who developed fibromyalgia in the context of extremely high psychosocial stress. There's a true psychosomatic, I don't like the word psychosomatic, but psychologically induced, maybe neurobiological or something here. But she found herself later on very sensitive to chemicals. Around chemicals was worse, feels best at the ocean beach, away from chemicals. Another case here, a 41-year-old female primarily suffering fatigue, noted in the environmental pattern. She had nasal congestion worse with dust mite and pollen. And her symptoms were typically worse in the kitchen with natural gas stove. Remember, the natural gas stove does not burn 100%, so you're getting some in your kitchen. It also gives off carbon monoxide. Remember, that was one of the 12 stressors there, as well as nitrous oxides. Felt better outside of her home, particularly, again, at the ocean beach. Other researchers who have looked into the correlation between exposures in the environment and symptoms, Dr. Iris Bell in Arizona found that exposure to volatile organic compounds and pesticides appeared to initiate chronic fatigue and fibromyalgia, even with chronic low-level exposure. Here's a Swedish study on cosmetics. This will make you all think twice here. Some cosmetics are more toxic than others, and so they looked at toxic cosmetic usage and fibromyalgia syndrome. They actually reduced the toxic burden of the chemical cosmetics, and it resulted in less pain and stiffness, improved sleep, and general function. Dr. Grace Seam is occupational medicine, environmental medicine back on the East Coast there, and she has documented numerous chemical agents triggering chemical sensitivity, fibro, and chronic fatigue. And here's a list of things that she looked at: gasoline, kerosene, natural gas, pesticides, solvents, new carpet, adhesives, carbonless copy paper, fabric softeners, formaldehyde, carpet shampoos, cleaning agents, and certain medications, specifically prolonged antibiotics and the use of general anesthetics. Well, what do these examples tell us? They tell us that environmental stressors can initiate and sustain conditions like fibro, and therefore the prudent patient needs to deal with them to optimize health. Okay. Given that you've got muscle pain, tender points, and fatigue, what goes into diagnosing the inflammatory processes behind fibromyalgia? Well, we look at the total load. I mentioned that before. Total load. Think of a barrel. I have a picture on my wall of a barrel. So here's the barrel like this. Total load is a great concept because it looks at what's inside this barrel. What has to add up before it spills over the top? Spilling over the top is like having symptoms. And you see, in linear medicine, there's only one thing to think about. But here we have multiple things that may add up together, creating this inflammation, and all of a sudden we have symptoms. So this is part of what we look at, how to diagnose that. We look for nutritional deficiencies. I think you had a nutritionist talk today, and I wish I had heard that there. But obviously taking a history, we send a number of our patients to nutritionists for help, by the way. But taking a history, we have a checklist. What do they eat? Some people, you look at that, no protein. Oh, that's interesting. Or they're just loaded with, give me more MSG. We love it, you know. So what are the needs? And I talk about intake because you want to have good stuff coming in. Some people are losing a lot. We get patients that deplete magnesium easily, for example. We also looked at impaired digestion and absorption. We'll use stool study tests that take stool samples and so on that will give us clues as to whether or not there are problems with digesting and then absorbing the food. Liver function is important because liver is a major detoxifying organ of the body, plus all the food is coming there from the gut. Sleep deficits. History helps with that. Sometimes we use the sleep laboratories. Hormone deficiencies and imbalances, just to pause a moment on that, they're not as easy to sort out as you might think. I mentioned the TSH thyroid issue there. We will use blood samples at certain times, timed blood samples, 24-hour urine samples for hormones. With some of them, we use the saliva collections. Those are most accurate with the free cortisol levels and so on. But we have to look extra hard on our thyroid. We check TSH sometimes, but usually we check free T3, free T4, and tie that in with the symptoms and trials of therapy. Environmental exposures in the past as well as the present are important in diagnosing the underlying inflammatory triggers and causes here. And so you want to know what type of job do they have? Or what did they do 10 years ago? Some people will have exposures and they've accumulated waste in their system that is still there. So they have an internal toxic environmental exposure. Inhalant allergies, we do a lot of work with those. Pollens, pet, dust, and mold. We'll do skin testing to see if they're reactive. Valerie had these negative tests there, and that can happen. Also, there's different techniques for doing the allergy testing. We have the prick or scratch test, and there's the intradermal test. We use the intradermal, a little bit more accurate, and particularly if we're trying to pick up on mold sensitivities, it'll pick up at a level in a patient who needs to have a little bit higher exposure before their skin changes on that.